let's talk about SIBO symptoms and how you can treat those. Hey, I'm Dr. Meyer and welcome to my channel. If you're new here, welcome. And if you're coming back, thanks so much for coming back. I'm a functional medicine doctor, family doctor, and a registered dietitian. And as you can see on this channel, if you look at any of my other videos, I talk about gut health, hormone health, and metabolism health or metabolic health. So lately I've been focusing on SIBO. I have a whole playlist from the past also with some new and old videos in there where I've talked about SIBO. SIBO is small intestinal bacterial overgrowth, if you don't know, and it causes a lot of gut problems, bloating, digestion problems, diarrhea, abdominal pain, skin problems, fatigue, weight loss or gain, and can contribute to just a lot of feeling unwell. And if you want to check out that playlist, I do have it available. I've helped hundreds of patients in my practice, and I've helped even more here on YouTube with this information. So please leave me a comment if you've been struggling with SIBO, and please like, subscribe, and share the content to help the channel grow. So I've been talking again a lot about SIBO, and it can be methane SIBO or IMO, it's now called, hydrogen SIBO or hydrogen sulfide SIBO. If you want to know more about the testing for that to figure out which type you have, please check out some of my other videos and check out the SIBO playlist. But to review, like I talked about last week, some of the symptoms of SIBO, like I said, could be bloating, diarrhea, abdominal pain, constipation. They could be skin-related acne, psoriasis, rosacea, or anxiety, brain fog, an exacerbation of like your brain fog or depression, weight changes, being really sensitive to certain types of foods, like basically carbohydrate foods, processed sugars, processed flours, breads, pastas, that kind of thing. Anything from flour can create those symptoms. So there's a lot of common symptoms that SIBO can contribute to. And then particularly if you have hydrogen sulfide SIBO, that can create body pain, bladder irritation, and tingling, kind of neurologic feelings, tingling, nerve pain, and then more food intolerances, particularly to sulfur-based food. So that's a tricky one to diagnose. I promote a lot the food marble and conventional, that can diagnose methane or hydrogen just like the testing you would do with, Genova or any of the home breath tests, or if you go to a lab and get the breath test, they can only diagnose hydrogen or methane SIBO. You can diagnose hydrogen sulfide SIBO through a special test that I'll put in the description called TRIO, or you can look at if you have a trained SIBO provider you're working with, they can look at your test and see if it looks like it's a hydrogen sulfide test. But another topic, I've talked about that in the past. So those are the symptoms that I just mentioned earlier that could show you that you have SIBO. Now, those symptoms will usually go away with SIBO treatment, but sometimes we have to choose multiple different treatments. So if you want more information on the treatments I use, I have the SIBO playlist and I have my SIBO ebook, The Ultimate Guide to SIBO. I'm going to put that link in the description. It's pretty affordable. Like most people can fit that in their budget. And if you have Kindle membership, you can get it for free. So that'll be there for all your SIBO information. But while you're going through SIBO treatment, you're going to have these symptoms still, the discomfort, acid reflux, nausea, constipation, diarrhea. So let's talk today about what things I like to use with my patients to help alleviate those. So with nausea, or what we call dyspepsia, that can be pretty common, especially if you have a gastroparesis. So one thing I've used with my patients, and you've probably heard of before, are the acupressure wristbands. I'll put some links in the description. SIBO are one name for them. They're like the nausea bands that you can get for pregnancy. That can work for SIBO-related nausea also. Ginger, and I do use ginger as a motility agent. Motility is super important for SIBO. So the migrating motor complex, all the things I've talked about, keeping that flow going. Ginger really helps with that. Now, ginger can cause you to feel like you have heartburn, but know that it's the ginger, it's not heartburn. And I recommend you usually taking ginger at night. Typically, I'll have people take 1,000 milligrams at night, but that's for motility. If you have nausea, I'm usually recommending you take your ginger, maybe a lower dose, 500, something like that, with your meals, or with whenever nausea appears for you. I also like a product called Iberogast. Has no relation to any of these brands, but I do have some discounts and they are affiliate links. And if you want to help the channel grow, you can use my full script dispensary discount and that can help the channel grow. You can also get Iberogast. You cannot get on full script. You can get on Amazon, and I'll put a link below in the description on that. So other prokinetics can help your nausea sometimes. Motegrity is a very expensive medicine in this country. You can order it from Canada. Also, if you live in Canada, you can get it cheaper. If you live in other countries other than the US, you can get it cheaper. But maybe your insurance will cover it, and that is a motility agent, and that does help nausea also when it's gastroparesis related sometimes. And peppermint and caraway oil, like in FD Guard, I'll put a link in the description, that can help with nausea as well. Now let's move on to constipation. I see that a lot. It happens a lot with methane or IMO, SIBO. And you can use, of course, magnesium. Citrate or oxide are the most common types of magnesium to help with constipation. Sometimes electrolyte mixes, potassium can help. I use liquid IV a lot with my running and if I'm out in hot places, and that does have the electrolytes in there, but there's some other more simple powders you can get for electrolytes that I'll put in the description. You can also use stool softeners, of course. You've probably tried that if you have constipation, but suppositories are okay to use sometimes. You can use the Iberogast also. It's interesting blend because you can use it for nausea. It's a German blend of herbs. Nausea, constipation, acid reflux, and diarrhea. It can work with any of those. Diarrhea is sometimes yes, sometimes no. I've had mixed reviews on that, but it can definitely help all those others, and I've used it in diarrhea with success. Especially if it's SIBO based diarrhea. So that is a blend of herbs. You do want to talk to your provider about any of these things. I'm not your provider and I don't know your health history, and I can't diagnose or help with that over YouTube because I'm not your individual provider, but you can check with them to see if these herbs are safe for you. You can also use short chain fatty acids for constipation and getting your fiber. Obviously, that can help fuel the gut bacteria in a good way if you tolerate it. Now, the most SIBO friendly fiber that you can use to help this is sun fiber. I've used that a lot. I've recommended it a lot. I talk about it a lot, so I'm going to put a link for that. It's very FODMAP and SIBO friendly. And then probiotics. So now I know I talk about SIBO and probiotics and how SIBO can be set off by probiotics. That is true. So I usually wait to use probiotics until a few weeks into the SIBO treatment, just so you know. But it's worth a try if you want to see. Maybe it doesn't set off your SIBO and maybe it helps you. But if it does set off your SIBO symptoms, probably want to wait to use them. I really love Orthobiotic by Orthomolecular. I'll put a link in the description. And I like probiotics that have a blend of Bifido, Lactobacillus, and Saccharomyces boulardii. So there is one that I've talked about before, a women's blend, but it does have a prebiotic in there, which can definitely set off SIBO. So I save that one for after we've treated SIBO. You can also drink warm water, warm lemon water, or just warm water in the morning, and that can help your constipation too. Now, diarrhea is another problem. You can use electrolytes for that. If you're losing a lot of electrolytes, that's helpful. Probiotics, again, with the disclaimer listed above that you maybe want to wait a few weeks to start them. Bismuth is helpful, particularly if you have hydrogen sulfide SIBO. So bismuth is what's found in Pepto-Bismol. Now, I don't love Pepto-Bismol because it has the pink colors in there. Why do we have to make it pink? I don't know. So there's a one I like that I'll put in the description that I like better. You can also use immunoglobulins. There's something called SBI Protect by Orthomolecular that I really like for diarrhea. And a brat diet if needed. Now that's bananas, white rice, applesauce, and toast is usually in there. You're probably not going to tolerate the toast well if you have SIBO. You could tolerate the applesauce, maybe not actual apples. So that's just for really bad diarrhea. We don't want to do that on an everyday basis. And then, of course, there's the over-the-counter diarrhea medicines like loperamide. I tend to want to try these other things first, but if you need that, that is usually at most pharmacies. And then if you're having acid reflux, ideas for that, or you may have low stomach acid, believe it or not. You feel like you have high stomach acid, but a lot of times you have low stomach acid, and there is a test for that. I will have a free PDF that you can download if you join my email list that shows you how you can test at home for, and it's easy. You just use betaine HCl as long as you haven't had an ulcer or actively being treated for Barrett's esophagus. You don't want to use that then. So anyway, you can use HCl, bitters, apple cider vinegar, diluted, of course. There's dilution recommendations available out there, and you don't want to drink it straight, is what I'm trying to say. You can also use calcium carbonate like Tums, but I like the Whole Foods version of Tums, or some of the ones on my dispensary that don't have the fake colors in them. And then activated charcoal can be helpful for acid reflux too. I've done videos just on acid reflux options. I do like DGL, deglycerinized licorice. Now, a lot of times the things that are in that to make it tolerable to eat, or not to eat, but to take, have some of that, the ingredients that we don't want to use for SIBO. So I will put one in the description down below. That's a powder that doesn't have those ingredients, and it may help your acid reflux while we're treating the SIBO. Melatonin is actually fine to use in SIBO, and that can be used for acid reflux too. So if you have acid reflux, you probably want to check out my H. pylori and acid reflux videos and dive deeper into that. And you may find that those H. pylori symptoms and everything are resolved, that comes from them are resolved when treating the SIBO. So this was just kind of rundown on if you're going through what can be a long extended treatment for SIBO, some things you can add to help SIBO. So hopefully this was helpful. Please like, subscribe, and share if you want to keep the channel going. That will really help. Also, if you want to help the channel and help me make content, you can buy quality supplements through my Fullscript dispensary. And you can check out my playlist too, and check out the ebook. The ebook can really help me continue to make these videos, and it's got all the information you need on SIBO. And again, the food marble testing and looking for trigger foods, a little device you can use. It's awesome. I'm so glad we had this technology. So if you want more information, I have a whole video on that, but you can get 15% off the food marble with the link in the description too. So thanks so much for watching to the end. I'll see you next time.